Welcome to Diabetes Day by Day, the American Diabetes Association's official podcast. I am thrilled about today's episode. The title is There's an App for That, where we're going to explore the world of mobile health technology and how it's shaping diabetes management. There are a lot of apps out there, and they're for counting glucose, carbs, logging fitness activity, pulse oxes, and suffice it to say, it can be a little overwhelming to figure out which one is the right one for you. Today, we're going to look at diabetes apps, and we're going to hear from experts on the features that truly make a difference for us. Now, first, I just want to make sure we all understand, and this is an important disclaimer. This episode is not a sponsored episode, and none of us are endorsing any specific app. The ADA is not endorsing any specific app. These are just examples of apps that have worked for many people and examples that you can use either using the app or apps like this. Our goal today is to give you insight to help make the best choice possible for your health. I'm Dr. Neil Skolnik, Professor of Family and Community Medicine in the Sidney Kimmel Medical College of Thomas Jefferson University, and joining me as always is my co-host.
Thanks, Neil. I'm just as excited for this episode. I think we'll have a lot of interesting information to talk through. I'm Dr. Sara Wettergreen, an assistant professor at the University of Colorado Skaggs School of Pharmacy and an ambulatory care clinical pharmacist.
And joining us as well to share their expertise, we've invited two guests. The first is Susan Weiner, who is a registered dietitian and a certified diabetes care and education specialist. She is a nutrition, health, and diabetes expert and has robust knowledge of diabetes-related apps. Welcome, Susan.
Thank you so much. It's so wonderful to be here. I'm excited for today's discussion.
Our second guest is Bridget Wood, who is a registered dietitian, certified diabetes care and education specialist, and someone who has lived with type 1 diabetes for over 15 years. She is the owner of Bridget Wood Wellness and shares her expertise as well as personal experiences across platforms from social media to online blogs. Welcome, Bridget.
Thank you. I'm so glad to be here, Neil.
This is going to be a really interesting episode. Let's start with the big picture. Susan, how would you describe the role of apps in supporting people living with diabetes?
That's the top question to start with. When a person is diagnosed with type 1 diabetes, they have to make roughly 180 health-related decisions each and every day. That translates to over 8,700 hours a year spent on diabetes management and care, but only 28 minutes a year with a healthcare provider, right? Before apps and the growth of app technology, we had people filling out enormous amounts of questionnaires to get information, and then through so much overwhelming information all at once in their laps. What should I eat? When should I eat it? What do I do when I exercise and my blood glucose level drops? Not in real time, they would have to make these decisions. So with the global explosion of apps providing this information, keeping the data all in one place, in real time, providing this information, it can be very useful when used effectively and efficiently. And there are approximately now 350,000 health and related and wellness apps. I know it's mind-blowing. And at least 90,000 of them have been added since the 2020 pandemic because people switched over to telehealth and were not seeing healthcare providers at that time. And there were approximately 11 or 1,200 diabetes-specific apps. So you're right, Neil, we're not going to get to all of them today. That's really the mile-high view of what's going on with apps.
That's so helpful, Susan. You really clarified the need for a way to organize information. But I'll tell you what, you also clarified how hard it is to find apps. The app that's right for you. And I want to ask you about safety. So when we look at medical devices, they often have to go through vetting by the FDA. These are not, even though we're using them for managing a medical condition, they're not registered as medical devices. There's over 1,000 of them out there. Can you make any recommendations how to tell if the app you're using is good?
Yes, really important point. Most apps and most of the apps we speak about today are not under FDA clearance and FDA guidelines. Why? Because they're not medical devices, like an insulin pump would be. An insulin pump is a medical device that would go through FDA clearance and look at FDA guidelines. So it is extraordinarily important as medical providers, as healthcare providers, before we recommend any app, first of all, download it first, see about the usability, see about the health literacy on the app and how it works. Because I think the number is about 80% of apps that are downloaded are never used, right? So if you look at your phone and all the apps on your phone, you could start swiping and deleting them. Of the apps that you're using, make sure to read through that privacy devices. Just don't sign off when you look through it to see if your data is being shared. And if you don't want to share your data, make sure not to use that particular app. It's extremely important to look at it. But most devices, some of the insulin dosing apps and such, will have FDA clearance because of how they're being used, but most of them do not. So you need to do your research on safety and efficacy of the apps because most of them are not under the FDA umbrella of clearance and guidelines.
Now, Susan, when you say do your research, is it adequate? What I usually do when I go to download an app, I try not to download the apps that don't have a lot of reviews. That puts a lot of them in one bucket. And then I look at the reviews. Not one is I see how many stars it has. And if you have something with a few thousand people and 4.5 stars or better, it's usually pretty good. And I'll read a few for something that is this important. I'll read a few of the good reviews, but I also pick off a few of, you can select out like the 1-star reviews. Is that enough of a way to have a reasonable sense and then use your judgment as you move forward?
I think that that's one way to use your judgment. Sometimes people put reviews on just to put reviews on that might not be overly accurate. There may be some emotion that is tied into that. I want to make 2 recommendations if you want to look in a peer-reviewed, everything you want to know about technology and apps. One is diabeteswise.org. Diabeteswise.org for people with diabetes who want to look up everything, no cost, everything technology, but a fantastic review of apps. What is usable, what's efficient, what's user-friendly, what's accurate, it's great. And Diabetes Wise now has Diabetes Wise Pro for healthcare providers to look at that too. And of course, is developed by people who are living with diabetes on the back end initially. So it does have a community-based part of doing that. ADCES also has Dana-Tech, which is free. And Dana-Tech reviews all technology and all apps and has a very, very robust app section to review all these things about a number of different apps. Now, both of these, those are my 2 best go-tos, but both of these are not reviewing 350,000 health and wellness and diabetes related apps. But the top ones are in there, constantly being updated with really enormously fabulous information. That's what I would do.
That's so helpful. Bridget, any additional thoughts that you have for our listeners about how they might choose an app or make sure an app they are trying is a legitimate one?
Yes, I'd agree with Susan, and also just looking within the community and seeing what everyone else is trying. Everyone's different, but you might find a commonality between your friend and be able to find an app that works for you that way. Definitely agree with everything she's saying. Spot on.
That's fantastic advice. And one advice point that I want to add to this is work with your healthcare team, especially a certified diabetes care and education specialist who might be more familiar with these apps and might be more familiar with the information from these two amazing resources that Susan shared with us, where you can learn a little bit more and get some hands-on recommendations. Before diving into particular apps, I'd like to learn a little bit more about what app features people living with diabetes might find helpful. Bridget, would you mind please sharing some features that you've found helpful or that you've seen through your work with other people living with diabetes have found helpful?
Yes, absolutely. And so to go back to what Susan was saying, we're making, and I'm just going to round up, a bajillion of decisions a day. So for me, ease of use is going to be huge. And then just making sure that I have the ability to have multiple devices on one app, to have multiple information sources on one app so I can see everything in one place. But for a lot of people, they like to look at the carb counting as we move away from more regimented carb counting and being more carb aware. I think it's super important to have these resources to help and guide people to have the most accurate information that they can when looking and planning meals. And then also people like to use exercise tracking and looking at their movement. And so having all of that information in one place can help them provide them with all the information that they need to make actionable insights to actually take control and empower themselves to take care of their own diabetes.
I love that term actionable insights, thinking of not only how am I going to collect this information and track it, but what does it mean for me? Like, how am I going to take action on that information as it comes in? And as you said, I think it can be really helpful when tools combine that information where you're able to see not only your glucose, let's say, but also pull together other resources. How many carbs did I have at that meal? What insulin dose did I give? How was my exercise throughout the day, potentially influencing that glucose reading as well? So rather than having 10 different apps where you have all that information and go one to one, it might be helpful to think about apps that have the option to have multiple features combined and thinking about usability as well, not needing to remember to go to all these different apps because as Susan said, it sounds like 80% the apps are not really used. So the more apps that you have, it seems like it could be complicated. So it sounds like it would be most beneficial to start with a few and really figure out how to use them and if they're working for you. So thinking about that and thinking about all the different apps available and all their different features, people with diabetes have so many apps to choose from. We've already heard lots of numbers, lots of different apps and features, and some combined, some all do separate things. So it seems really overwhelming. I think when I think about the process of selecting an app, I don't know where people would start. So we'd like to hear a few specific examples from each of you today. Let's start by talking about glucose tracking. Susan, would you mind sharing a few apps that you found useful for people living with diabetes who are tracking glucose?
Of course, and Sarah, also to your point, before recommending any app, we must ask a person what apps they're currently using, because some of the diabetes specific apps may have other features, to your point, that are already included. Maybe it has some nutrition features within the diabetes app, so adding another nutritional wellness app to that is really overkill and overwhelming. So very good point and very important point. There are a number of different apps that are diabetes specific, but really do address a number of other comorbidities and other conditions. So that's an important feature to know. But in terms of something that's specific and more simple to use for glucose tracking, there's one called Glucose Blood Sugar Tracker, and that pairs with a number of different agnostic and specific glucose meters like AccuCheck, for example, and it syncs to Apple Health, as do many apps. So this is very important, the interoperability of what you're already using. So if someone's an Apple user, I am, and I have an Apple phone and I use the iCloud and I have an Apple Watch, all of that information, again, and Neil asked before about the safety of it, when you agree to have your data shared, all of that data and your steps, your sleep, your heart rate, all of that can also be incorporated into some of these other apps, right? So all of that information is being taken into one place. And the point is that in the past, and as a dietitian in my own practice, I would send people again, what did you eat in the last 24 hours? What did you eat in the last 3 days on a food frequency questionnaire? I don't know about you, but I'm not sure exactly what I ate yesterday. So some of that information may not be kept correctly. But now with these apps like the blood glucose sugar tracker and several others, all of that information is one place and can be sent to you in a report. So very helpful. There were also a number of caregiver apps like that are part of a whole system. For example, Dario Health, Livongo Teladoc, as well as My Sugar. And these include blood sugar tracking and can give information for a number of different health conditions, including hypertension, right? Knowing what your blood pressure is. So all of that information is collated into one place. You're also provided with either a meter from that company, or it can be used with an agnostic meter to collect your blood sugar. And those are some examples of apps. And also coaching is provided in app with those companies that can help you on your daily guidance with diabetes, including motivation. So that's very important, and nutritional guidance.
That's fantastic. That's so many different apps. And for our listeners, I imagine some of you might be driving or in a place where you can't write these down. We will reference these different names in the show notes and link to the apps so that you can have that direct information. So if you want to keep track of these, we can also reference that information there. But I think to me, one of the things that stands out is the first one you mentioned, Susan, is called Glucose Blood Sugar Tracker. And I feel like if I just saw that, I would think, what is this? Exactly. I think when the name may not always reveal all the different features and tools that are within each of these apps, and it's helpful to have some of these other resources as a place to start.
The glucose blood sugar tracker primarily tracks glucose, gives you an idea of your A1C, all of that as well, generates reports. I just want to make sure people know that I'm not going over the cost or the free versions, or if there is a premium version. So when selecting an app, we want to make sure that all of that information is also reviewed. But that is a simple app. The glucose blood sugar tracking app is more of a simple app. It's not as integrative as some of the other apps that I mentioned.
Thanks for that. That's really helpful. It might have some other features, but it's great to recognize that different apps, depending on the free version versus a paid version, might open up different features. So that's a great point to recognize as well. Bridget, any other apps you'd like to recommend or talk about at this point related to glucose?
Yeah, I guess I'll go ahead and say that it really depends on your why for the app. And for me, since I'm always having my CDCES hat on, I'm always looking at those patterns in real time. And I'm using my G7 app now that I'm on G7 and utilizing that primarily because these apps they're changing constantly. Their landscapes are changing. They're adapting to actually work with features that are going to be best for the users, best for people living with diabetes. And I found within the G7 app, even though it isn't connected to my pump or connected to certain other devices, it does have the connectability to Apple Health, so I can see my activity. I can input my medication doses. If I take Afrezza or some other type of other insulin, I can put in my food. And so these apps are becoming more friendly, but also more convenient for us because we're already looking at our blood sugars real time, whether it be within the app, whether it be on the G7 app or our watch or what have you. And so that's where I'm at. But a lot of other people, they like to have the ability to get outside of those apps and not necessarily see the real-time blood sugar. They just want to look at the patterns and look at the trends. And so I definitely recommend something like a Tide Pool or something like Susan was mentioning, more device agnostic, where you have that bigger picture and you can see everything.
That's a great point. So thinking about glucose tracking, one of the key points is that we know many people now are using continuous glucose monitoring devices. And with that, you'll have a designated app from that company where you'll get to see your glucose data. It doesn't mean you couldn't combine that usage with other apps, but you already have access in one location. Neil, what are your thoughts?
No, it's so helpful, and with so many different apps, and they don't all cross function. I'm thinking of Omron is one that has an app for blood pressure. And the one thing I'd also recommend to our listeners is bring those apps in. Obviously, they're in with you, they're on your phone, but share them with your provider. Show them the data. One of the things that's important to realize as you have apps that you use all the time. You're the expert with that. And we often say something like, ask your doctor. And I see doctors get very afraid when someone says that about apps because we don't always know all of the details, but we can help interpret those details and charts that you bring in. I mentioned the Omron app that has made such a difference for blood pressure management because it used to be where I'd tell someone to take home blood pressures. They'd rigorously do that. They'd come into the office. I'd say, what does your blood pressure look like? And they'd say, oh, I forgot my piece of paper at home. And now all of that information is there. Don't be afraid to share what you're using, to share the data, and learning is often bi-directional.
When we think about how people are selecting an app, there's a couple of ways as healthcare providers, to your point, Neil, that we think about that. One is that if your organization, your healthcare system, your hospital, your practice is using an app, you may be familiar with it. And if that conversation comes up, you can suggest it. But more often, to your point and to Bridget's point, that may come from a community of people with diabetes, or you're seeing that other people are using it. Either way, the safety of the app, the usability of the app, again, the health literacy of the app and the level of using that amount of technology is extremely important to discuss.
And Susan, you mentioned community. I think that's so important because earlier we talked about how do you figure out which app to download. And in a way, that was as if we're living isolated on an island, and we aren't. We are part of a community, and most often the best recommendations and the recommendations we trust most come either from people we know who have tried something, or from, as you said, if a community of users that we trust.
And within these
Yeah.
apps, we also have a lot of community engagement in certain of the apps. So that is an important point as well. Thank you for bringing that up.
We've heard a lot about a few particular apps today and getting some oversight into what's the safety features and how do we think about these apps big picture. But I want to share a little bit of background of where some of these ideas about apps came from. So in December, I attended a conference where I had the opportunity to hear Susan speak about more weight management and nutrition focused apps, which many people living with diabetes might be using, or some apps in diabetes care might have some similar features. And something that really stood out in that presentation from you, Susan, was regarding the safety of these apps in people with disordered eating behaviors. Can you share a little bit more information about specific considerations you would have in those individuals?
Absolutely. And as you could tell from when you attended my presentation, I'm very passionate about this topic, which is often overlooked. When a person is diagnosed with diabetes, one of the first things that people are bombarded with is about nutrition and food and counting and carbs and calories and all of it. And a well-meaning clinician can sometimes make matters worse. We don't mean to, but sometimes it happens. For example, and Bridget and I have had this conversation personally, when a person is diagnosed with type 1 diabetes and getting the proper amount of insulin, they may initially gain a certain amount of weight. They're rehydrated, and a well-meaning physician or caregiver or provider may say, now you don't have to worry about the 30 pounds that you just lost. You're getting insulin and your weight is going to regulate to where it was. And this kind of information can overwhelm a person who is now being asked to carb count and look at everything they're eating and how what they're eating is related to their blood glucose levels. With all the apps that are out there for nutrition, weight management, people taking GLP-1s, especially in the type 2 diabetes community, who are also trying to manage their weight, where this is top of mind, we have to be extremely cautious and not recommend weight management apps specifically for people who may have eating disorders or exhibiting disordered eating behaviors, many times of which we have no idea what the etiology of that might be, and they might not be easily recognizable. And eating disorders often happen in secrecy. Apps can be used in secrecy and very quietly. So being aware of that whole phenomenon that is going on with using apps for weight management and how that may affect diabetes, your mental health, is very important.
I think that's such a critical point, and I appreciate you sharing that, Susan. And when I think about these apps, that's such an important safety feature and consideration is if you start using an app and you notice certain behaviors are changing or you're noticing it has an influence on your mental health, maybe stop, maybe bring that information to your healthcare team to see if there are other options that might be safer for you or work better for you.
So we're about out of time. We only have a few minutes left. This has been a great discussion. Susan, any final thoughts for our listeners?
Please listen to what a person who is living with diabetes is saying to you. Communication is very important. Providing information without receiving what a person's goals are is not going to make any difference in their well-being physically, mentally, emotionally. So please ask a person about their diabetes journey, their use of technology and apps, and go from there.
That's so helpful. Bridget, final thoughts that you have.
Yeah, I would say just do whatever's best for you. And if you find an app and you don't quite like it, try another one the next week. And if you don't like that one, maybe just give it a break and try it when you feel like it's the best time to actually try the app. We're all so different. And the beauty is that there's so many different apps. And even though you might not find the one that's right for you today, you might find the one that's right for you tomorrow. Don't give up.
That's fantastic and so important. Sara, your thoughts?
My final thought is similar to Bridget. So, when thinking about planning for our episode here, it was hard to find an individual who's actually using apps in their diabetes care. I think because of this overwhelm, there are just so many to choose from. So, I hope that this episode was helpful in giving individuals listening resources of places to start and thinking about at least trying one, maybe try one new app as a result of this episode to see if it can provide benefit in an area that you're looking for additional support. And if not, try another and continue to move forward from there.
Such important points. And it's very clear that what we have to accomplish, want to accomplish when we have diabetes can be overwhelming. And there are resources now that we have that we didn't have 20 years ago. And apps are certainly one of those resources. At the same time, and Susan, you made it so clear how many apps there are out there. Sara, as you opened with, it can be overwhelming. Hopefully, we've accomplished helping our listeners sort through that, at least to some degree. And I think one of the most important things was that idea of being clear what your goals are. You don't just look for an app in isolation, you look for it with a purpose and then find the app that meets the purpose that you're trying to accomplish. And getting suggestions from that community of users. Bridget, you used the word actionable insights, so important. We don't want to just have information. We want information that we can use to help with the things that we're trying to accomplish. Thank you, everybody, for joining us. And of course, most importantly, thank you to our audience. Just after this podcast was recorded on February 5th, the FDA issued an alert on the potential to miss critical safety alerts due to phone settings when using smartphone-compatible diabetes devices or apps. Sara and I felt it was important to add this information to our discussion. The FDA said that they've received reports from some users of diabetes apps that alerts were not being delivered or not being heard, and in some cases this has led to harm. This underscores the degree to which many of us rely on apps for the management of many important day-to-day activities, including diabetes management. This is a reminder to check your notification settings to make sure that alerts from important apps work, and to recheck those settings at least monthly, since sometimes updates of software can change those settings. Also, make sure that the notifications from an app work when your device is in the Do Not Disturb mode. The FDA statement goes into further detail. We encourage you to look at it, and we've included a link in the program notes. I hope this discussion was helpful and that you'll explore the world of diabetes apps now with some knowledge to help sort them out. For the American Diabetes Association, I'm Dr. Neil Skolnik. Thanks for listening.